a deadly disease and a pressing issue in India.
In a country where the total female population is more than 659 million, taking care of women's health is still neglected.
This has led to the mortality rate among Indian women being more than 4 million.
Research by WHO also shows that only 1 in 10 women have been screened for cervical cancer in the last 5 years in India. Whilst cervical cancer ranks as the second most frequent cancer amongst Indian women. Cervical cancer is a serious health issue that disproportionately affects women from low socioeconomic backgrounds. Women in low-income communities may lack access to regular checkups and screenings, making it harder to detect and treat cervical cancer early. Misinformation and lack of education about cervical cancer prevention and early detection can lead to delayed diagnosis and treatment. It is important to understand that cervical cancer can affect anyone, regardless of their socio-economic status. However, women from low-income backgrounds are at a higher risk due to the barriers they face in accessing healthcare and education.
In some Indian cultures, there's a belief that health, including the occurring of diseases like cervical cancer, is influenced by karma or the law of cause and effect. This belief suggests that past actions, both good and bad, can have consequences in the present life. Some may interpret cervical cancer as a result of negative karma. Additionally, the concept of fate or destiny can play a role. Some people may believe that certain events, including health issues, are predetermined and cannot be changed. This belief can lead to a sense of helplessness and a reluctance to seek medical care, even when early detection and treatment can significantly improve outcomes.
Linking cancer to sexual activity. Cervical cancer is often associated with sexual activity, and it is this association that can lead to shame and embarrassment, preventing women from seeking medical help. Fear of judgment. Women may fear being judged or stigmatized by the society if they disclose their condition, which can lead to delayed diagnosis and treatment. Protecting family reputation. In some cultures, a diagnosis of cervical cancer can be seen as a disgrace to the family. This fear of societal judgment can deter women from disclosing their condition and seeking necessary care. To maintain silence, family members may pressure women to keep their diagnosis a secret to avoid social stigma. This can lead to isolation and a lack of support.
About cervical cancer within our school community, focusing primarily on students and teachers. However, after conducting interview with students, teachers and medical professionals, we realized that the lack of knowledge about cervical cancer was prevalent across both privileged and underprivileged groups.
We learned that while privileged individuals may have access to information, they often overlook it due to various reasons. On the other hand, underprivileged communities face significant barriers accessing information and resources related to health.
We organize separate awareness sessions for students, support staff, and parents. These sessions covered topics like cervical cancer, its causes, symptoms, prevention, and the importance of HPV vaccination. In an effort to promote preventive healthcare among students and staff, we organized free HPV vaccination camps. To ensure parental consent, we set up a booth on Founders' Day to collect necessary forms. We also received a word of assurance from our school principal, Ms. Maya Narula, to facilitate the vaccination camp for both students and support staff. In collaboration with the local Rotary Club, we were able to provide free vaccinations to support staff, recognizing their potential barriers to accessing healthcare services.
We also set up an informational booth on our school's annual Founder Day, where we provided the event attendees with brochures and answers their question about HPV vaccines.
It is quite imperative that young girls take the HPV vaccine to prevent cervical cancer. And this idea, of course, has been growing in India for a while. And we have been wondering as a school how to take this stand by actually educating parents about it. So I'm glad that this initiative came from our grade 10 IGCSE students, because they were able to, through their research and their various different interviews with doctors, able to influence girls into believing that this was a very good option for them. And once they had done that, they were able to talk to parents as well. So as far as I'm concerned, all of those hesitations that we had initially were actually handled very well by the girls. And we have now written to parents asking for their permission to be able to give students the injection, and we are hoping to be able to do this in February next year. But in the month of December, we are hoping to vaccinate a lot of our support staff from the villages in the neighboring area, them and some of their relatives as well. So we hope that that particular camp goes very successfully. Thank you.
We created informative brochures in Hindi to educate the general public about cervical cancer and preventive measures. These brochures were distributed to raise awareness and encourage early detection and prevention.
We were able to collaborate with Dr. Manisa, who agreed on placing our brochures in her hospital, Graphic Era Medical Hospital.